Introduction to Care Coordination. You will learn an overview of Shondacare Home Care Agency. Role of the Care Coordinator. You will learn key skills required for the role. Here is an overview of Shondacare's Home Care Agency. We will talk about the agency mission, vision, and values, overview of services provided, and we will go over the discussion on the role of the care coordinator within the agency. Introduction to Shondacare Home Care Agency. Shondacare is a home care agency that provides in-home services to individuals who require assistance with daily living activities due to age, illness, or disability. We are committed to providing a holistic approach to high-quality care that promotes independence, dignity, and quality of life for clients and their families. Our agency mission, vision, and values. Our mission at Shondacare is to provide compassionate and personalized care that supports the physical, emotional, and social well-being of our clients and their families through a holistic approach. Our vision. We envision ourselves as a leading provider of in-home care services that are grounded in respect, integrity, and excellence, and that provide our clients with access to resources they may not have known about. By offering a holistic approach to care, we strive to provide our clients and their families with the support and tools they need to achieve optimal physical, emotional, and social well-being. Our core values of compassion, respect, integrity, teamwork, and excellence guide us in everything we do. We are committed to providing high-quality care and support to our clients and their families, and we strive to make a positive impact on their lives every day. At Shondacare, we are more than just a care provider. We are a partner in your well-being. Overview of services provided. Shondacare provides a range of in-home care services, including assistance with daily living activities, IADLs, medication management, and supporting nursing, physical therapy, occupational therapy, and speech therapy while they are in the home. We also provide respite care for family caregivers as well as end-of-life care and housekeeping. Discussion of the role of the care coordinator within the agency. The care coordinator plays a crucial role within Shondacare Home Care Agency by coordinating care and services for clients and their families. The care coordinator is responsible for assessing clients' needs, developing care plans, coordinating care and services with healthcare providers, and monitoring clients' progress. The care coordinator also advocates for clients' needs and ensures that clients and their families are informed and involved in their care. The care coordinator works collaboratively with other healthcare professionals, including nurses, therapists, and social workers, to ensure that clients receive comprehensive, coordinated care that meets their individual needs and preferences. We will be going over the role of the care coordinator and understanding the responsibilities of the care coordinator and key skills required for the role: organizational, interpersonal, problem solving, and communication skills. And we will also discuss on how the care coordinator's role fits into the overall team structure of the agency. Responsibilities of the care coordinator. The care coordinator is responsible for coordinating care and services for patients or clients who require long-term or complex care. The following are some of the specific responsibilities of the care coordinator. Assessing the patient's needs and creating a care plan. The care coordinator is responsible for assessing the patient's physical, emotional, and social needs and developing a care plan that addresses these needs. The care coordinator works with healthcare providers, social workers, and other professionals to coordinate that patient's care and services. This could include arranging appointments, coordinating transportation, and ensuring that the patient receives the necessary treatment. Monitoring progress. The care coordinator is responsible for monitoring the patient's progress and adjusting the care plan as needed. care coordinators also communicate with patients, family members, and caregivers to ensure that they are informed of the patient's progress. Advocating for the patient. The care coordinator advocates for the patient's needs and ensures that their rights are protected. This includes helping the patient navigate the healthcare system, providing education on options, and addressing any concerns or complaints. Key skills required for the role. The care coordinator needs to possess a range of skills to effectively carry out their responsibilities. Some of the key skills required for the role include organization skills. The care coordinator needs to be able to manage multiple tasks, schedules, and priorities to ensure that the patient's care is coordinated effectively. You can use a task management system to stay organized. This can be such as a to-do list, a planner, or a digital calendar to keep track of tasks and deadlines. You can prioritize tasks based on urgency and importance and schedule time blocks to complete each task. Another key skill is that we need to develop a care plan. The care coordinator can develop a comprehensive care plan that outlines the client's needs, treatment goals, and care schedule. This can serve as a guide for coordinating care and help the care coordinator stay on track with the client's care needs. Coordinate with healthcare providers is another key skill. The care coordinator can coordinate with healthcare providers to ensure that appointments, treatments, and medications are scheduled and administered according to the client's care plan. This can involve communicating with providers, sharing medical records and information, and ensuring that the client's care is coordinated across different providers. Another key skill is maintain accurate records. The care coordinator can maintain accurate and up-to-date records, including our medical record system, treatment plans, and care schedules. This can help the care coordinator stay organized and ensure that the client's care is coordinated effectively. Another key skill is communication and collaboration. The care coordinator can communicate and collaborate effectively with all parties involved in the client's care, including family members, caregivers, and healthcare professionals. This can involve scheduling regular meetings, providing updates on the client's care, and ensuring that all parties are informed and involved in the care plan. By using a task management system, developing a comprehensive care plan, coordinating with healthcare providers, maintaining accurate records, and communicating and collaborating effectively, the care coordinator can stay organized and effectively coordinate care for clients with complex needs. Interpersonal skills. The care coordinator needs to be able to communicate effectively with patients, family members, caregivers, and healthcare professionals. They must be able to build relationships, establish trust, and work collaboratively with others. The care coordinator needs to be able to communicate with clients effectively to understand their needs and concerns, explain the care plan and treatment options, and provide education and support. They must be able to build rapport and establish trust with the client, ensuring that the client feels heard and understood. Family members and caregivers. The care coordinator needs to be able to communicate with family members and caregivers to provide updates on the client's care, address any concerns or questions they may have, and ensure that they are informed and involved in the client's care. They must be able to build relationships and establish trust with the family members and caregivers to ensure that they feel supported and informed. The care coordinator needs to be able to communicate effectively with healthcare professionals, including doctors, nurses, social workers, therapists, and whoever else may be part of the care to coordinate the client's care and services. They must be able to work collaboratively with others, establish trust, and build relationships to ensure that the client receives the best possible care. The care coordinator may also need to communicate with other service providers such as transportation providers or home health aides to coordinate the client's care and services. They must be able to establish effective communication channels and build relationships to ensure that the client's needs are met. In each of these scenarios, the care coordinator's interpersonal skills are critical for building relationships, establishing trust, and communicating effectively with individuals from diverse backgrounds with varying needs and concerns. Effective communication is essential for ensuring that the client receives comprehensive, coordinated care and support. problem-solving skills. The care coordinator needs to be able to identify and solve problems that arise during the patient's care. This includes addressing issues with treatment, scheduling, or communication. Identify barriers to care. The care coordinator needs to be able to identify barriers to the client's care, such as lack of transportation, financial constraints, or language barriers, and develop strategies to address these barriers. Resolving conflicts. The care coordinator may encounter conflicts between the client and their family members, between different healthcare providers, or between the client and the healthcare system, or between the client and the caregiver. The care coordinator needs to be able to identify the underlying issues, facilitate open communication, and develop solutions that are in the best interest of the client. Addressing gaps in care. The care coordinator needs to be able to identify any gaps in the client's care, such as missed appointments or incomplete medical records, and develop strategies to address these gaps. This may involve coordinating with other healthcare providers or working with clients' family members or caregivers. Adapting the care plan. The care coordinator needs to be able to adapt the client's care plan as needed based on the changes in their condition or new information that arises. This may involve working with healthcare providers to adjust treatment plans or coordinating additional services to address the client's evolving needs. Managing complex cases. The care coordinator may work with clients who have complex medical or social needs, which may require coordination with multiple healthcare providers and service providers. The care coordinator needs to be able to manage these complex cases, identify potential issues, and develop solutions that ensure the client receives comprehensive, coordinated care. In each of these scenarios, the care coordinator's problem-solving skills are critical for ensuring that the client's care is coordinated effectively and that any issue or barriers are addressed in a timely and effective manner. Effective problem-solving is essential for providing high-quality care and support for clients with complex needs. Communication skills. The care coordinator needs to be able to communicate clearly and effectively with all parties involved in the patient's or client's care. This includes providing information, explaining procedures, and advocating for the patient's needs. Active listening. The care coordinator needs to be an active listener when communicating with clients, family members, and healthcare professionals. This involves focusing on what the speaker is saying, asking clarifying questions, and summarizing key points to ensure that the message has been understood. Clear and concise communication. The care coordinator needs to be able to communicate clearly and concisely when explaining medical information or care plans. They should use simple, jargon-free language and avoid using medical terms that may be unfamiliar to clients or family members. Empathy. The care coordinator needs to be empathetic when communicating with clients and family members. They should be able to put themselves in the client's shoes and understand their concerns, fears, and needs. This can help to build trust and establish a positive working relationship. Cultural sensitivity. The care coordinator needs to be culturally sensitive when communicating with clients from diverse backgrounds. They should be aware of cultural differences and be respectful of the client's beliefs and values. This can help to build trust and ensure that the client feels supported and understood. Advocacy. The care coordinator needs to be an effective advocate for the client when communicating with healthcare professionals or service providers. They should be able to clearly and assertively communicate the client's needs, concerns, and preferences and work collaboratively with others to ensure that the client receives the best possible care and support. Timely communication. The care coordinator needs to communicate in a timely manner, keeping clients, family members, and healthcare professionals informed of any changes or updates related to the client's care. This can help to ensure that the client's care is coordinated effectively and that all parties involved are informed and involved in the process. In each of these scenarios, effective communication skills are critical for building relationships, establishing trust, and ensuring that the client's needs are met. By active listening, communicating clearly and empathetically, being culturally sensitive, advocating for the client's needs, and communicating in a timely manner, the care coordinator can effectively coordinate care and provide high-quality support for clients with complex needs. How the care coordinator's role fits into the overall team structure of the agency. The care coordinator is an essential member of the healthcare team and works closely with other healthcare professionals, including doctors, nurses, social workers, caregivers, therapists, family members, anyone involved in the care. They collaborate to ensure that the patient receives comprehensive, coordinated care. The care coordinator may also work closely with the patient's family members and caregivers to ensure that they are informed and involved in the patient's care. This collaborative approach helps to ensure that the patient receives the best possible care and support. In conclusion, the care coordinator plays a vital role in coordinating care and services for patients who require long-term or complex care. They must possess a range of key skills, including organizational, interpersonal, problem-solving, and communication skills to effectively carry out their responsibilities. The care coordinator's role fits into the overall team structure of the agency by collaborating closely with other healthcare professionals and working to ensure that the patient receives comprehensive, coordinated care. Thank you for watching. If you have any questions, please call us today, 413-217-9861, or visit us at www.shondacare.org.